We're going to look in the mouth for any sores, assess mucous membranes for hydration, look in their ears, nose, make sure there's no abnormalities there, look, feel their head to make sure there's not any deformities, any lumps. And then we're going to go into respiratory assessment. So you're going to ask them if they've had any shortness of breath, coughing, if they're coughing, if there's any sputum production. We're going to listen to their lungs on the front, the sides, and on his back. I'm going to note the rate, the depth, effort, and any symptoms that he may have had that were respiratory related. Cardiac assessment, you're going to listen to their apical pulse. Check all of your pulses that I went over to make sure they're even. Note the rate, the rhythm. You're going to check for any edema in your extremities, and note the temperature and color of your extremities as well for any cardiac problems. For his abdomen, you're going to make sure that you put him in a supine position on his back. We're going to look at the shape of the abdomen and assess the overall appearance first. And then we will listen to all 4 quadrants for up to 5 minutes to make sure that we hear bowel sounds in all 4. And then you want to palpate the abdomen. Make sure that there's no tenderness, no masses. Throughout the entire body, you'll make sure there's no masses or lesions on their skin anywhere. For the abdomen, you're going to ask them if they've had any nausea, any vomiting, the frequency of bowel movements, if there's any blood in their stool. You're going to ask them if their stomach hurts. And then you want to ask about their urination, how many times they've urinated, if it's decreased or increased, the color of it, if there's any odor to it, any abnormalities with their urination. And then if necessary, you would look at their genitalia to see if there's any abnormalities there. For a female, you want to ask about their menstrual status, if they're still having periods, if they went through menopause, when the last one was, if they're heavy, if they're about normal in cycle. And then for females, you can do a breast exam if necessary, pap smear, pelvic exam. Then for female or for males, you would do a testicular or prostate exam if necessary. You want to note their overall condition, look at their toes, at their feet to make sure there's no abnormalities there, sensation, if their strength for neuro exam, their strength is equal on both sides with their hands and their feet. And then document any abnormal findings, report anything that's abnormal to the charge nurse.